basically a patient with normal or even pretty good testosterone levels is going to these different TRT telemed clinics and seeing what they have to say, what they check for, more importantly, what they don't check for. And I think you came into the clinic for a lunch and we were like, oh yeah, we did a podcast on this study. And you're like, oh, I published that study.
Well, more than a year ago, we discussed a study called a Secret Shopper study, and where a sort of hypothetical patient goes to several telemedicine clinics and then sees what happens. But basically, we were fans and we thought, man, it would be so nice to talk to one of these authors.
Yeah, basically a patient with normal or even pretty good testosterone levels is going to these different TRT telemed clinics and seeing what they have to say, what they check for, more importantly, what they don't check for. And I think you came into the clinic for a lunch and we were like, oh yeah, we did a podcast on this study. And you're like, oh, I published that study. So I was like, wow, that is very cool. Small world.
Yeah. I mean, one of the biggest reasons we looked at this study to begin with is pre-COVID, there's such a huge uptick, as you guys know, in the number of people using these direct-to-consumer sites for things like Viagra and Cialis. And then we started to see this slow transition into people starting to use more and more testosterone. COVID happened, telehealth really took off, and there was a major concern that, there are drugs that are more dangerous than Viagra, things like testosterone that have potential side effects and that may not have been prescribed in a safe manner. So when I was at Northwestern, some of the other faculty and one of my colleagues who was coming in the year after me decided to put on this Secret Shopper study where he had a grossly normal testosterone. I think it was 650 if I'm remembering correctly. And then we pulled all these different things saying, hey, I have low energy, I have low sex drive, I think I need testosterone. And it was amazing the number of responses that we got. There were several people that basically said, well, that lab wasn't done when we said it could be done, and we discarded them. I think we ended up with 7 total companies. And I know you guys have reviewed this before, but actually being able to hear the script, hearing the actual people on the other end of the companies offering testosterone without asking appropriate questions. We could talk about the guidelines and things all you want, but the real problem we had here was the lack of questions about cardiovascular health, the lack of questions about whether or not somebody wanted to have a child in the future, not offering preservation, and then offering a lot of drugs that may be considered off-label. I mean, really, of all the 7 people we looked at, only one single study talked about fertility preservation, on one single center rather, which is just remarkable what's kind of out there.
Yeah, we thought the same thing, and maybe we can link to our previous videos that have discussed this. But one of the things that we found particularly interesting is a flowchart that you and the other authors had proposed regarding a future template for what telemedicine, hormone optimization, or HRT could look like or should look like in the future.
Yeah, I mean, I think things are evolving beyond that even right now. I mean, again, if you look when the guidelines were published, we're talking, it seems like just yesterday, but these things were 2018, 2012, and then 2023, depending on Endocrine Society, American Urological Association, and then the European equivalents of those. I think that the most important questions are the ones that we already somewhat addressed as somebody's overall health, which is something you guys deal with all of the time. But when somebody comes in for a hormone evaluation to a urologist, a lot of times I'm getting, minimal amounts of wellness labs. And I talk to them about their fertility, but there's so many other reversible medical issues that can be addressed ahead of time. And that's kind of, again, the tip of the spear, so to speak, with that is doing a true male wellness exam, which I do think we have good infrastructure to do through telehealth. Beyond that, obviously, the labs. I think there's some digression in terms of how imaging may be involved, and without getting into too many things, but testicular ultrasounds and things that don't allow you to necessarily lay hands on a patient. But we have some ways to navigate that with the hope that we'll be able to broaden access to these services, especially in areas that don't have knowledgeable providers.
Yeah, so expanding in a safe manner with good screening and monitoring in place for those that are started on testosterone in this manner. It's not, here's your script, see you in 12 months, and there you go. Because I think that is the case with a lot of these telemedicine TRT. It's kind of a high volume, low time with the patient sort of operation.
Yeah, and again, most of this stuff is strictly following the guidelines, which I would hope telehealth or in-person providers would have some understanding of how frequently to reassess labs after starting somebody on it to make sure that their levels are where they're supposed to be, make sure they're not developing high levels of red blood cell counts that could cause things like heart attack or stroke. And also, again, near and dear to my heart for men over the age of 40 is making sure that they're not developing or had undiagnosed prostate cancer.
Yep.
So again, being very careful both with the initial workup and maintenance is incredibly important.